Japan has banned fans at Tokyo area Olympic venues due to the virus. Is that enough? How safe will these Olympics be?
Yeah, Mehdi, it's unfortunate. And to put it into context, Tokyo had about 920 cases, and that's approximating 1,000 cases, which was its most kind of volume of COVID-19 prior to this recent surge. So this is very serious. They've been talking about the strain on infrastructure in Tokyo if they can't control the crowds. To your point, however, I would say the Olympic athletes themselves are kind of, there's an incredible testing protocols and incredible strategies to absolutely try to protect the athletes as much as possible. But your point, I think, is the right one. You can only do so much, even if you ban spectators, if travel and all sorts of, indoor gatherings, et cetera, take place when you have a more infectious variant. And again, you mentioned vaccination rates. Japan, a very advanced country, only 15% vaccinated. So we're seeing an incredible opportunity for the virus to procreate, proliferate, mutate. And that's unfortunately how we're going to, this global story has not ended, including the story in the United States. And I worry that somehow we're prematurely declaring victory, and we can't.
I can't remember the number. I can't count how many times on this show I've discussed with a doctor, including with you, how many times premature victory has been declared on this damn pandemic. The CDC says 99.5% of COVID-19 deaths in America are from unvaccinated individuals. It's clear now the link between deaths and lack of vaccinations. So what does that say about parents who are still refusing to give their teenage kids the vaccine before they head back to school in the fall?
Yeah, it tells one thing, that we're still not connecting the facts and the science with what could happen to your child. I think it's incredibly irresponsible to just, say that your child does not need the vaccine. I would offer that that's exactly the conversation you should be having with your pediatrician. And I would say, Mehdi, we have people who can't advocate for themselves, children, young and older. At some point, we will have a vaccine for younger children as well. So we need to keep that in mind, that it's not just about your one kind of situation. It's really about how the community is going to benefit, and that the safety profile continues to grow. We have administered 3 billion shots in this world. So we have volumes of real world evidence. But I hope that these conversations happen like with physicians, with pediatricians, with family doctors, but they're not happening right now. We've plateaued, we've stalled. I'm not seeing as many people, and I can't convince the ones that don't want it to get the vaccine now.
Yeah. And just during the last couple of hours, some news, Pfizer saying it's developing a booster shot to target the Delta variant. Clinical studies could begin as early as August. What do you make of that timeline? And are we going to need specific boosters for specific different variants going forward?
Yeah, I hope not. Look, we just spent time talking about how people are not vaccinated. Can you imagine on top of that, then trying to take, half of the country that has been vaccinated and boosting them? So I think the manufacturers are doing the right thing by advancing progress on a potential booster. I will tell you, just advancing that and putting in an application with trials doesn't mean that everybody is going to get a booster. And I'm still trying to figure out how can the United States put much more of a show of force to get the world vaccinated. 70,000 cases in Indonesia. I mean, things are just feeling like they're ripping apart at the seams. So Pfizer is doing what I would expect them to do, working, continuing. No, we do not need a booster for each variant. Is it likely that you and I are going to need some additional shots at some point? Yes. The timing on that is going to depend on how quickly we can vaccinate the rest of the world. And that we do play a role in, ourselves included in the United States.
And we're now hearing not just about Alpha and Delta variants out of the UK and India, but also the Lambda variant, which is spreading fast in South America. Are there any signs that this strain is even more contagious than the other contagious variants?
Yeah, it's unfortunate. In Peru, we're seeing almost 100% of those cases with the Lambda variant has a particular mutation on it that actually makes the other mutations we're seeing in Delta even more powerful on the spike protein. So again, the virus doesn't have any emotions. It doesn't know any boundaries. It's just trying to stay alive. So it's going to do what viruses do. So these mutations are natural, happen, and are adding up into something serious. And by the way, I was just reading New York City took down much of its contact tracing and public health response. Feels like it's feeling a little bit like deja vu. Like, we don't need testing, we don't need tracing, we're fine. And that's if you're vaccinated, you are safe, but we're not fine as a country.
It's crazy. And before we run out of time, I have to ask, my home country, the UK, dropping all restrictions in a couple of weeks. Everything goes. No social distancing, no masking, no nothing. That's a crazy experiment, is it not?
It is. And we have lives. We have 4 million lives. But if we had this happen for any other reason, people would shut down everything. But it now seems like we've developed an immunity to the numbers, and we haven't learned. And so I worry about what we're going to see come forward the winter and next year as well.
Oh, so depressing. Dr. Kavita Patel, always appreciate your insights. Thank you so much for your time tonight. Hi, I'm Mehdi Hasan. Thanks for checking out our channel on YouTube. You can see more of the Mehdi Hasan Show by clicking on any of the videos on this screen, and make sure you subscribe below to stay up to date on the day's biggest stories. Thank you for watching.